I was recently asked, how long did you go without smiling? 5, 8, maybe even longer. I covered my mouth. I was afraid to talk. I would stop talking to people and socializing. So I'm a nurse. I worked with Dr. Berger. He has a fabulous reputation. He's the best. So I went to see him, and he replaced all of my teeth. And I've got my teeth are better now than they ever were. And I have the best smile that I could ever have. Now I can eat. You know, I can chew. I can, have steak. I can have apples. I can have peanuts. I can have all the things that I couldn't have before because I didn't have the teeth to chew them with. My teeth are stronger than my original teeth ever were, and I'm very happy. And the surgery, it wasn't painful at all. Matter of fact, I think I only took 1 Tylenol after the surgery. I had a little bit of swelling, a little bit of bruising, but that didn't hurt. And my temporary teeth that they put in, they felt fabulous. But then when I got my permanent teeth, they were better than my real teeth. They're better, they're stronger, they're prettier, and my smile is nicer than it ever was. I should have done this years ago, but the problem was I couldn't find the right person. I went to many doctors, many dentists, and saw what they had to offer, and I wasn't comfortable. And as soon as I saw Dr. Berger and Dr. Ayers, oh my God, they're like the best. And it was a no-brainer. I mean, for sure, I was just going to get everything done all at once, get it done, be happy, and be able to smile again. My smile now is best ever. I was even told at work the other day, you know what? When you were laughing, your smile was so beautiful, you should be on TV. You've got the prettiest smile and the most natural smile, and it's perfect.
Oh, before I had this done, I had an upper plate and a lower plate, or partials. They were partials. And they were just miserable. I dropped one, stepped on it, and broke it, had to get another one made. And it was just downright embarrassing to go out to eat. I haven't eaten out in 2 years because of my teeth. I was just so conscious about having lousy teeth, and they were terrible. I saw a commercial on television about this, and I went on the internet and discovered it. And here I am. And I've loved every minute of it. I wasn't nervous one bit whatsoever. It was just so great. And I got up, I had new teeth. It was just fantastic. I thought it was very good. I just loved every damn minute of it, excuse me, but all of it. And I only took in the pain involved, I only had two Vicodin in the whole process. One day and one another day, and that was it. That was the first day and the second day. A little discomfort, yes, that's natural, but now I'm not embarrassed to go out to eat. I can eat a corn on the cob. I haven't had one in 2 years, but now I can, and it's just wonderful. I just can't think of anything else to say or much to say about it except it's just wonderful, and I love it. If I'd have known about it, I would have done, because I went to one dental place and they said one of the dentists said, dentures are miserable. And I said, well, I'm gonna look at implants, and that's when I did. I saw it on a commercial, then I went on like I said, on the internet and looked at it, and it sold me, and called them up, made an appointment. And they were so great, I did it. And the finances, yeah, it's expensive, but it's downright worth it. I said, well, I would rather spend it on myself than Wall Street getting it. And that's what my thoughts were on that. I said, it's my turn. I want to live. I don't have that many more years left, so I want to enjoy what I got left. After you reach 70 years old, you want some good life afterwards. And so here I have good teeth, and I can't say enough about how great they are. No problems whatsoever, nothing. I can eat anything I want, when I want it.
For many years I've had teeth that were not the best in the world. It's been wonderful. I can talk to people and I can enjoy myself at parties, and I'm happy to smile again. As you see, we've got good teeth all the way through, and it's just really a whole new life, actually.
And with PermaDontics, those problems are gone. I had good care, it was intensive care, and I got the job done and I got what I want. I'm really, really happy. Well, I'm one of those few people, I should say many people, that had problems with their teeth until I went to PermaDontics. It's a whole different world. I can now chew, I can now eat, I can now live a normal life. And let me tell you, it's worth everything. Money is no object, although it was an object, but it's no object to get teeth like this. They are absolutely out of this world. I sit here not as a recommendation, but as a guarantee that you need teeth like this. They are wonderful. They are absolutely wonderful. Before, my teeth you could take out, put in. It didn't work. There were always problems. But with teeth like this, some people asked me, they said, is it painful to have this done? Absolutely not. I felt nothing. I went in, I came out with teeth right away. There's absolutely no pain, and it is absolutely a joy. Let me tell you, it is a joy. Now, I have my permanent teeth, nothing take in, nothing came out, and I'm one happy man.
I had very few teeth left on the top of my mouth. The whole top is upper implant. The bottom is still my own teeth. And so it's a very good match. And today, the things I'm able to do is I smile and I laugh with my whole mouth now. I had been forgetting how to do that. I had been hiding behind it. I don't have to put my hand in front of my mouth anymore to hide the missing teeth that was always visible. And I can have things like celery sticks and apples that I previously wasn't able to have. And it's just a whole new me now that I'm able to smile. Procedure was fine. It was simple. It was in and out in the same day. I was talking to the anesthesiologist, and then I woke up in the dental chair, and I went home, and I had to put ice and heat and alternate with that. And I did have to sleep sitting up for the first night, but I was back at work within a week, and it wasn't at all like other surgeries that I've had. It was a little bit of bruising, but the pain was very minimal amount of pain. So I'm very happy with it. And I was able to do things like eat an apple right away. And then I went back and I said to the dentist, I'm eating an apple already. And he said, no, please don't do that. You need to let the bones heal. You need to let the bones heal up in the jaw. Well, I couldn't feel as the bones needed to heal. That's how firm it felt to me. So I had to follow the directions, even though I felt like I should have been able to just go for it. I wish I had done this years before. It's something that I'm very pleased with. It was affordable. It wasn't out of my range, and it is so much more convenient than the wobbly dentures, so much more pleasant for me and my family.
I came in to the dentist because I had some chipped and loose teeth. I had some missing teeth, and it was starting to affect the front of my teeth, so I started looking around to see who I could go to see what I could do about it, and I found Dr. Ayers. I was very worried about what the pain would be like because I don't like pain. I mean, nobody does, but I think I don't like it more than most. And he talked to Dr. Ayers. He told me what the procedure would be like. I went in, had it done, was in and out in maybe about 6 hours. Went home and generally didn't have any pain. I took the pain medication, didn't have any residual pain afterwards. It was a really easy and I guess a good transition from the time that I had the procedure to going home. I mean, within 24 hours, I felt like myself. I smile more. I used to be afraid to smile. I'd cover my mouth, or I just wouldn't laugh or anything when people would say jokes. And I'm eating more things. They're easier to eat. And maybe a third would be I'm just happier. I'm glad that I went through the procedure. I wish I'd gone earlier. I think what stopped me was the fear. I was afraid of what the pain was going to be like. I had a really bad experience with the dentist when I was younger, and so once I reached an age where I didn't have to go to the dentist, I chose not to, and that's where all my problems started, you know, when you don't go and get your annual care that you need. So it took me a long time to get the courage up to go to see somebody and see what I can do about it.